The medical scientists will forgive me if I don't waste my 4 minutes in thanking them. I stand here in solidarity with them, and I want to thank People Before Profit Solidarity for bringing the motion. And Minister, I'm not sure how you could possibly not agree with this motion. It's the most basic motion I've ever seen, and it calls for 3 things, which I can't understand how you don't agree with them. Ensure that DEEPR and the HSE agree to the long-standing pay parity, begin a recruitment campaign, publish a plan. Now, I don't know if you're serious how you couldn't agree with that. Instead, we've got a response from you talking about hidden heroes. Medical scientists are not hidden. They're not hidden to me, they're not hidden to the opposition, they're not hidden to the hospital staff, they're certainly not hidden to the public who rely on them, including myself, who get, like every other woman, gets their blood tested. Not to mention the 200,000 tests that were carried out alone last year in Galway Hospital for COVID. They're not hidden heroes. They're hard-working medical scientists who are asking for equality and pay parity. That's it. Now, your speech should have dealt with the background to this, and you put a heading background. I was filled full of hope that you were going to give us the background, analyse what happened, and tell us what you were going to do. And instead of that, it's nothing. This is a report here in front of me. It has 112 paragraphs and recommendations, difficult 64 recommendations, written by 3 men, and unfortunately they didn't put the recommendations 1, 2, 3. Notwithstanding that, when you read through it, you see it's clear. And now it's time. May 97, the Labour Relations Commission recommended the establishment of an expert group. That expert group was set up in 97, following huge delays since 81, when all of these problems emerged. And then we go forward in this report, and they actually apologise for their delay in producing the report. I don't know why. They apologise for the length of time. So more delay, and we get this then in 2001. To add more confusion, within that, they say some of the recommendations should be implemented by the 1st of April 2000. The report was February 2001. But obviously there was interim reports and contact with the department, and put the date 1st of April. Maybe that is the hint, in that nobody was serious about this. Some of these recommendations were to be implemented by the 1st of April 2000. Didn't happen. Fast forward now, 21 years plus later, at a time where we're all expected to grow up, 21 years, the age of maturity. And what have we got? An answer back that it's positively insulting, let me say, Minister, and I do it with the greatest respect to your role as a Minister and you as not a personal thing. We can't go on like this. You must look at this report. What happened? Were any of those recommendations implemented? If that's so, tell us. If not, why not? Why wasn't there a review between now and then? Why have medical scientists to go out, give us all of this information? I want to thank them. And tell us how difficult it is, most reluctantly, to go on strike. Why is that to happen? It begs the question, is the structure that's there and the government fit for purpose? And in my opinion, it certainly is not. You had any amount of warnings that this was going to happen. And on top of that, I spent 10 years of my life on a health forum, and I watched the medical science laboratories being run down. The laboratories being run down and outsourced to private for-profit companies, and the medical scientists and all their colleagues asked and stood up and appealed, don't do this. And each government, led by the PDs, I might add, said, no, we're privatised. Privatise is the way. And then we get the scandal of the smear test and the cervical. We have learned nothing. So you should be standing here today telling us why that hasn't been implemented, what needs to be done, and what we're going to do about stopping the outsourcing and recognising the fundamental role that medical scientists have, so we can rely on them for their honesty, their courage, their hard work. I want to rely on them, and I do. I certainly don't rely on the government unless it's going to change. Garmagat.